Hi, my name is Mike Chartrand. I am on my way to Toronto tonight for my second surgery for varicocele. In 2008, I had a varicocele surgery without microsurgery, and I fought for 10 years to get it acknowledged that it had failed. My left testicle was still about triple the size of my right. Scrotum, I should say scrotal contents. The testicles are normal. Um, but I'm on my way. After 2 minutes in Toronto, I was diagnosed with bilateral varicocele, and I'm on my way tonight for varicocele embolization surgery because the damage in my inguinal canal was too much for Dr. Jarvie to do microsurgery, so he sent me to Dr. Beecroft, who's going to do embolization surgery. Now, this video is not about the 2 out of 10 achy draggy feeling that my first surgeon said. That's the pain level. Um, if your surgeon is telling you how much pain you're in, it's probably not a good surgeon. The patient should be the one telling the doctor how much pain they're in. So I believe that varicocele is basically a progressive condition and it affects some people more than others, but that if the surgery doesn't work, a lot of times they'll blame you for your level of pain. And if you have a similar story, I'd really like to hear from you. You can reach me at grade4varicocele at outlook.com and or go on my Facebook page. But so I was referred for surgery after I had started Kegels exercises and felt discomfort in the scrotum as well as the legs. I put on a hockey jock strap when I noticed that my testicle, this is back in 2008. I put on a hockey jock strap when I noticed my testicle was being squeezed between my legs when I did Kegels exercises. I took it off on the third morning to take a shower and was gradually dragged to the floor over a 5 minute period. My heart rate was 170 and I felt all day like I got punched in the gut. So there's no agreement among urologists, and this is why I'm proposing a study of varicocele. Uh, there's no agreement among urologists about what constitutes a painful varicocele that requires surgery. It is largely left up to prejudice and conjecture. That's why a comprehensive study needs to be done on the men whose surgeries have failed and the men who have been living a long time with a large varicocele. Now, I'm going to read from Campbell's urology textbook or read parts of it. Um, but keep in mind, this is volume 1 or edition 1, written in the 1950s. But a lot of surgeons that are working today have been trained with this idea, and prejudice passed down to them. So keep in mind that we know that varicocele causes the testicle to atrophy or die. It decreases testosterone and sperm count. The author here is attributing excessive cases of pain with mental disability, and despite this, and denying that varicocele causes serious pain. I'm sorry for it's hard for me to do these videos and to be very accurate. So it calls it an abnormal dilation and tortuosity. It says the incidence of varicocele have never been accurately determined. It has to be governed by the examiner, who determines in his mind what does and does not constitute a pathological dilation. Much has been written about varicocele's sexual excesses or unfulfilled desire. Um, the symptoms of varicocele are increased by exertion, and it was a difficult problem in the last war to differentiate between legitimate complaints and malingering. Symptoms of varicocele are some of the most difficult to evaluate in urology. The main complaint is a constant pulling, dragging, or dull pain in the area of the scrotum and sometimes testicles. Careful examine in every case is necessary for evidence of hernia, especially tenderness of the epididymis and testicles. Um, and Dr. Jarvie, in his article on scrotal pain, uh, you can find on the Mount Sinai Hospital website, attributes tenderness of the epididymis to scrotal pain, which I believe can also be attributed to varicocele. But he says the textbook says individuals have various thresholds. Now this is bizarre, considering what has been said and what's going to be said in here. Individuals have various thresholds for pain, which may account for the variability of response in this condition. Patients with varicocele often have a wide variety of unrelated complaints, such as impotence, nervous instability, lassitude, and general disability, which is certainly not related to the varicocele. So he gives no evidence of this, but it's a bizarre statement because your hormone levels are off. Your testicles dying, but that's no reason for anxiety, um, or excessive pain. And then he says, your testicle. Some patients often complain of smaller testicles on the side of the varicocele, and an unknown percentage of patients with varicoceles do have smaller testicles on the evolved side. So your testicles dying, but don't be nervous about it. And that's no reason for abdominal pain or different types of pain that we don't understand, basically. Um, a greater percentage of varicoceles are more apt to have somatic complaints. Somatic, that's psychological. When large varicoceles do not lead to symptoms, it taxes the ingenuity of the examiner to appraise the symptoms from the minimal varicocele. In our practice, we're convinced that all patients complaining of general symptoms, of which the varicocele is about one, should have psychosomatic consideration, so blaming the patient. We must be convinced first before, in other words, all people with mental disabilities shouldn't have surgery, but he says we must be convinced that there is no constitutional neurasthenia and that the pain and discomfort directed towards a scrotal venous enlargement is reasonably bona fide before contemplating surgical therapy, so ruling out people with mental disability from it. And I have mental disability in my family, so I was shoveled off to the side. Patients must be studied as a whole, or else unnecessary operations will be performed on maladjusted individuals. And then later it says, testicular atrophy is usually associated with a large-sized varicocele. So stay tuned. I'm going to have more videos. But this is why I think more study needs to be done on the oddballs. Thanks for listening.